Today's episode of the Gestalt Education Show is brought to you by three of our favorite sponsors: Human Locomotion, Core 360 Belt, and Dynamic Disc Designs. All the information can be found below. By now, you have definitely heard us talk about them, so check out the show notes, click the links, use the codes, and make sure you support our favorite people. As always, we got a great episode lined up for you today, and thanks for tuning in. All right, everyone, welcome to another episode of the Gestalt Education Show. Today we are still at the DNS World Congress. Brett, it all came to fruition. We're in the middle of day two, basically. And so day one was all about principles, day two is all about application, and then three is more hands-on, which is going to be a lot of fun. And so today's guest, we are super excited to have Dr. Clare Frank. And so Clare, I've known your name for a long time, obviously through the Prague School, but this is my first time getting to meet you, so it's a true pleasure. And so can you maybe just start off and kind of tell your origin story? Like, how did you find DNS? How did this all kind of come about?
Well, after graduation from PT school, my first exposure was actually to Dr. Shirley Sahrmann. Mm-hmm. So 1 year out of school, got to hear her speak in a conference of 2,000 people, mm-hmm. and something kind of grabbed my attention to understand much more about the neurological system, the movement system. When I first graduated from PT school, I was going into the neuro route. Mm. So really exploring, because I really like working with stroke patients and spinal cords. So that's what I thought I was going to get into. But then after hearing her speak, something clicked, and she kind of took me to a trajectory where kind of exploration about the movement system.
For those of the people who don't know, Shirley Sahrmann, she's a famous physical therapist from St. Louis, actually.
Yes, that's
She's
right.
taught it at Wash U. So what are some of the biggest learning moments you learned from Shirley? Like, what are her gold medals? What is she so good at?
Yeah, when I first heard, because, when I came out, I was fresh out of PT school, so, you do your traditional muscle length, range of motion, mm-hmm. but didn't really understand the interrelationship of why the importance of how you move matters. And so I think that was what she kind of introduced. It's like how you move does matter, because she was influenced by Florence Kendall, who came out with her book in 1952 or so on posture and pain, where actually alignment and how you align a posture can be one of the big causes or contributing factors to pain. And so before that, people just looked at structural. And so it gave me a different lens to look at things. And so that was the beginning of my journey. Mm-hmm. And I would say 6 years. I would say at that time, not many people looked into the movement system, except for Shirley and her group. But that's because I did not know there was, on the other side of the world, there was Professor Janda in the Prague School. Mm-hmm. So I was actually learning this stuff on my own without any guidance, because who would I ask?
Right.
I was in LA, Shirley was in St. Louis, and I did not know there was all these pioneers in rehab on the other side of the world. So hit the books, tried to study as much as I can, and then the opportune time, 6 or 7 years out of school, trying to learn on my own, I had the privilege of meeting Professor Janda. And this was through Craig Levinson and Joe Gages, who are not a physical therapist. And when Professor Janda started to teach, I'm like, oh my gosh, he's taking it to the neural level, the brain level, which of course got me excited, because that was where my roots were.
Right.
So,
what were some of the similarities between Janda's model and Shirley Sahrmann? Because a lot of people compare those two quite a bit.
So I think in the beginning when Shirley started, because I have notes from her from 1986, I think. Mm. So she was talking about muscle balance, more like length tension relationship,
relative stiffness
and flexibility. So it was coming more from a biomechanical standpoint. But Professor Janda, when I first heard him speak, he was actually talking about the brain, where all this CNS is driving the motion, and so I saw that as, that's it. You marry those two, you cannot really separate the two, and that's what Professor Janda actually emphasized. that you cannot separate the CNS from the musculoskeletal system. So that was exciting because then when Professor Janda started to show all these different techniques, I'm like, oh my gosh, that is so similar to all the facilitation and inhibitory techniques we actually do on neurological patients. So there you go.
Yeah.
But then I have seen Shirley over the years as she started teaching and more, then she started talking much more about the motor control. And so even though they are coming from different points of view, but the ultimate goal, I think, is similar. Because she talks about the precision. It's like precision does matter, just like Professor Kolar would talk about.
Yeah.
So I don't think there's much difference, just like coming from a different lens.
Right.
So it's exciting.
Yeah, I think like people my age, we missed out on Janda, unfortunately. So of the stuff that Janda promoted or taught, what are you still utilizing? So are you still using wobble boards, rocker boards, balance sandals, or?
That's just part of it, you know, for sensory motor training. But I think what I took out from Professor Janda was basically body tells a story.
Right.
So he used to say that in class all the time when I was a new PT, and I'm like, I don't know what he's talking about.
Yeah.
It's like, I really don't understand, but as I start hanging out much more with him and just watching how he works with patients, that he didn't need a history, just like got information just from watching and observing. That was what he's talking about. The body tells a story. And actually, it's like, so I pay attention to how people move, just like how Shirley has taught me. Professor Janda, Professor Kolar in the Prague School. I'm a stalker.
Yeah.
I'm a stalker when they're not even knowing that I'm watching them.
Right. What about, did Janda and Sahrmann, did they ever actually meet in person or no?
I think they did I can't remember. I think they spoke one time a long time ago. I can't recall.
Yeah. Well, and so you went on to write a book with Robert and Phil Page,
Yes.
right? Kind of summing up
Yes.
everything from the Janda approach. What are some of the highlights of that book? And that had to be like a good experience,
Yes, it
like
was.
collecting all your thoughts and getting it all.
You know,
all together.
during my time there was not much computer, so it was basically handwritten notes that
Wow.
I wrote notes like for 10 years of notes hanging out with Professor Janda. So it was like compiling all these notes to actually write.
You could sell that.
It's like it's handwritten.
Yeah.
I have notes from Shirley as well. So one of the highlights I think is basically the interaction between the CNS and the musculoskeletal system, that you cannot really separate them. So when I look at how, through that lens, I call it the Prague School lens, the functional lens, that nothing can be isolated. So when I'm training muscles, I put quote and unquote, I'm actually thinking of how do I have access to the brain to change neural circuitry.
The engram, like the program.
Yes,
Yeah.
and that neural circuitry is sometimes, I call it, the brain is good, the muscle might be good, but the connection it has been corrupted or lost or absent, and that's where we as clinicians need to kind of bring that circuitry, make it a little bit like, get it to connect. And then the connection needs to be reinforced by, of course, compliance by the patient.
Yeah. People tell legendary stories about Janda's ability to observe patients
Yes.
and to observe movement.
Yes.
Yeah, can you speak on
Yes, he would one time. He sees this lady walk because when he was seeing patients, he would give a course, but then we would have special times with him where we brought patients in. So no history. The patient's walking, and he'll ask questions like, "Do you get your pain at 2 in the morning?" Well, like, where did that question come
Right,
from?
yeah.
And then he already, by the way she moved, maybe her age, but she's already thinking, I think he's asking this question because there was underlying osteoporosis. He's already talking about the biochemical changes that occur at night and stuff like that. I was like, wow, this is like blowing my mind. And then he's predicting, I think she may have a SI, a right side issue, right SI problem. or he was like, that's connected with the others. Just blown away.
Right.
And he was plagued with polio,
Yes,
so
yes,
I think a lot of times you end up taking an interest in something when it's
Right.
affected yourself, and I'm sure that's part of the reason why he got so got so good at
That's
good at
right.
his assessment. Yeah.
Because my history says that when he contracted polio when he was like in his teens, and he stayed in a wheelchair for a number of years. So during that time, he's just watching people, and he also, thank God, he's also like was brilliant, was one of those geniuses at that time, where he started to have this mission to really understand much more about the muscle system. It's because he was contracted with polio. And then you guys know that he got his medical degree pretty young, pretty early, and he wrote his first medical book when he was like 23 years old.
Oh, wow.
Oh wow.
So you talk about brilliance.
Yeah.
Yeah.
Still at all the libraries and the schools, they have the Janda compendium. I know they had them here because I used to always look
Do you
at
know
it.
how difficult those compendiums are to read?
Yeah, I know. Yeah. What can you comment on the relationship between Dr. Lewit and Janda?
I don't know too much about the history. I just know that Professor Janda was stuck in Czechoslovakia.
Right.
So, and I think Professor Lewit was in London at that time. So the opportunities that Janda did not have, I think, may have taken a toll on him.
Yeah.
And so after Czechoslovakia became Czech, where he was able to travel, and that's when you saw Professor Janda just traveling like crazy.
What do you think about, Yanda's kind of famous for his 6 test, and
Yeah.
I always tell the story that Clayton Skaggs told me they were in Buffalo doing a seminar, and someone raised their hand and they said, well, when you're doing your functional tests, and Janda stopped them and said, I haven't done my own test in 20 years, meaning like he just can observe at this point.
That's right.
Do you still have a place for like a hip abduction test or a hip exchange? Are you still using that as
I
an
still think
assessment?
so. I do that.
Yeah.
Because I don't think you want to throw away, just because all these new tests are being. I actually use simple tests like just range of motion actually as an inroad in how the person actually does it.
I know. Yeah.
So it's not like I don't do it because it's a planar, it's like a straight plane movement.
Right.
I still do my forward bend test. I do my arm elevation because it gives you so much information. So I don't throw away that.
What about, you mentioned Florence Kendall
Yes.
earlier. Do you do muscle testing?
Yes, I do.
Yeah.
So people will say, I know these days it's like you cannot isolate muscle. I totally agree with that. You cannot really isolate muscles. However, when I do a manual muscle test, it's giving me information on how maybe
The body attenuates the
Yes,
force, yeah.
Right. So whenever I put when I start putting the force on, I'm going to see how this person, I won't say recruit, but what is his first line of recruitment? How does he do it? And then when I apply the force, that gives me information on how he's actually getting help from the other muscles in the chain. So it's like compensation now.
Right.
So it gives me details, but I'm not going to grade like how strong this person is, because this person can hold his leg up by using his whole back, and that gives me information.
Yeah.
So I don't throw away the baby out with the bathwater.
Yeah.
It's still useful.
I think too, we've all been so mesmerized by
Yeah.
Pavel that unfortunately we don't talk about Lewit and Janda maybe as much as we could. What do you think is like some good, like a little one-hitter things that would be good from Janda that people are maybe missing out on now that,
Pay attention how people move.
yeah,
Really,
just an observation.
I think it's no different than what Paul is saying or Shirley is saying. You got to pay attention, especially when you're not aware that you're looking at them. Because the moment you tell someone, lift your arm up or whatever, they know you're already watching. So they may change it. But then sometimes you can kind of fool them into doing something like, reach for the second shelf. See, it's a different cue now. You know what I mean?
Right, yeah.
Then it's a different cue.
How much did Shirley evolve over the years?
I think she talks a lot about motor control. She talks a lot much more about when I say evolve, I don't know if she has. She's a thinker. Just as I was with her just a couple of days ago, she's still thinking about the interaction between the hip and the back. how, I mean, she's 87 years old, and yet she's still thinking about things like this.
Yeah.
Incredible.
Well, she's a legend in these parts,
Yeah.
with Washu being here. And yeah.
So she has, I think, I can't speak for her, but from what I've talked with her, and I think she loves the hip, the interaction between the hip and the back. It's like, I think it's no different than what others are saying. You cannot really treat a back without actually looking at that hip.
Right.
And vice versa. So it's all this, if you want to call it regional interdependence, that's what it is all about.
Right.
How the foot interplays with the hip, and the hip interplays with the trunk, all the way up to the shoulder. So,
So she's got some pretty elaborate protocols. Are you bought into any of those exact protocols, or
no, I'm not totally bought in. Not, I would say I don't use.
You don't utilize them.
I don't
Yeah.
utilize much, but it helps me categorize quickly if someone is a little bit more like extension sensitive or flexion sensitive. So I see it from that lens, and then my lens also comes from Prague School, where I'm looking at the regional interdependence and the level of motor control, the CNS. So how I'm kind of interblended so many different approaches.
Yeah.
Right.
Do you do much manual therapy?
Yes, I do.
Hands-on? Yeah.
Yeah, I'm a big believer of it.
Yeah.
Because I feel manual therapy is a inroad, like a neuromodulation to the brain. So yes, I can actually train from the brain, from motor control, but sometimes people do have restrictions where, like densifications, or something is stiff. So it could be I call it neurally mediated, but some folks really do have like restrictions, and that's where, why don't I kind of make it more pliable? How can I make less of the soft tissue or the joint a little bit more pliable, so that when I start training, I don't have to fight against resistance? Is that?
Yeah. Oh yeah.
Absolutely.
At the same time, I have had miracles where I just work on the brain, the motor control, and that release on its own. But it's not always the case.
Yeah. Sometimes you need the hard stuff, as we say.
Yes.
Exactly.
Yeah. So then the question is, people always ask me, how do you know where to start? I'm like, oh, that's where the assessment comes in.
Yeah.
Where you feel you need to not just do. Shirley always talks about, you're not just going to do a motion, you're going to feel the motion. Just as I'm lifting an arm up, I'm not just going to raise you up to see how much range you've got. I'm going to feel maybe where the tension is coming in, or restriction at what angle.
Yeah.
And so,
Well, there's no wrong answer as far as portal of entry,
Right.
because you can start and then we can reassess and we can see, well, I wasn't on the key link, and so
That's right.
there's really not a wrong place to start. I think with experience though, you kind of learn like
That's right.
where you get there quicker probably.
that's right.
Yeah.
Yes, I totally agree with you.
We started off camera. We were kind of talking about your kind of passion right now is education, and you have people with you basically every single day of your life in the treatment room, and you talked about how do we
Mm-hmm.
convey this assessment that you've taken all these years to come up with and to make these so much better in your observation skills. And so how's the easiest way to basically get someone up to speed so that they can start recognizing the things that you do?
I'm very fortunate to be involved in a program where I have fellows, like 6 fellows a year that I hang out with. Well, they hang out with me for almost a year.
Yeah.
So I feel like you can get a lot of information from going to classes. But if you want to get really good, it's like if you don't have the opportunity to be in a formal program, go find someone to work with, a mentor.
Yeah.
Because I think that's where you get the clinical pearls.
Right.
Because I did, as I said, I spent a lot of time with Shirley, taking her classes, and Professor Janda as well. But the clinical pearls I got was actually just talking with them and seeing patients with them. Because in theory, we all understand, that works. But then all of us know that we're in the clinic, all of a sudden they don't fit the textbook.
Yeah.
Yeah, right.
What do you do?
Yeah. Got to call an audible then.
Yeah, exactly. Well, I think that comes with your clinical experience and all the things we've already talked about. It, you know, you're a little bit from Shirley, a little bit from Janda, a little bit from Pavel, like integrating those all together, which is basically the crusade I think that we're all on.
That's right.
We understand that, you know, everything has its place, but then knowing when and where to do that is the difficult thing.
Yeah.
So,
Who else has influenced you? So we've talked about the Jandas, the Sahrmanns, the Kolar.
So
Who
manual
else?
therapy, of course, you know, because we were pretty, the osteopathic approaches, the Maitland approach. So the Maitland approach really kind of impacted me from the clinical reasoning process. Because if you look at Maitland's material, yes, he talks about the manipulation and the immobilization, but his line of thinking is actually about clinical reasoning, the critical thinking.
No, it really is.
So really, it's all about critical thinking, and so I've actually used a lot of that framework to actually put all these different approaches together.
I think Jeffrey Maitland's underrated and
Yes.
understated. Like I feel like he talked about a lot of things that should be talked about now that no one really talks about.
Yeah.
But he was the first one, like in the world of manipulation, to really like have a system in the world of manipulation.
Right.
So I think all his textbooks they're really good.
So if you look at his textbooks, yes, people always associate him with like mobilization and manipulations, but really, there's a lot of clinical reasoning.
And he was mixing and matching a lot of different stuff. I mean, he was talking about in-range floating. He was talking about the biopsychosocial model. Yeah, he was really ahead of his time, kind of like Dr. Lewit was.
and then maybe talk about just the Prague school's influence. So when did you first go to Prague, and kind of we've asked all the instructors kind of like the continuum from where you started to now where it is today is completely different.
You know, my first time to Prague was actually with Professor Janda, and that's when he spending the time there with him. We were there for 2 weeks, I believe. Was exposed to listening to Yuri, to Valley, to Lewit, and so Brugger, yes. And so just being exposed to that, like, opened another big can of worms. And that was also when I was exposed to Vojta. I saw it, but I didn't understand it. Anyways, to make a long story short, back to the States, you know, Professor Janda used to come back to the States. So every time he came back, I was very fortunate to be his TA. And so that I got to hang out with him more and glean more information from him. Over the years, Phil, Paige, Robert, and a few of us basically start to meet as a group to try to put his writings into a course. And that's how we met like a few times. And our first time, pretty nerve-wracking, we actually presented his material with him sitting in the back of the room.
Oh, wow.
And when we finished that course, it was done in New York. Of course, you know, you're always like, he's the master, so you don't want to disappoint your master, but at the same time, it's like, I hope he doesn't think we're talking nonsense. You know what he said? He said, I now can die happy.
Oh, wow.
What a compliment.
That is an insane compliment,
So, anyway, to make a long story short, it's like all these stories. He, you know, 2001, he passed away. But before he passed away, we were in Canada at the time, and Janda and I were supposed to teach a course together in LA. And so I said, Professor Janda, I'll see you in LA. I can't remember what month it was. He said, Claire, I'm not so sure.
Wow.
Because he was already ill. He said, I'm not so sure. You may have to teach it by yourself.
No way. Wow.
And a few months later, he passed away.
Wow, man.
But I'll tell you one thing that he told me, which I took it to heart. He said, you need to learn from Pavel. This was before he passed away.
This seems to be a general theme.
He said, you need to learn from Pavel. So that was the journey. After he passed away, I started to look
Do you know, was there a relationship with Janda and Vojta? Were they?
I'm not so sure about that. I'm not so sure about that history.
I had a surreal moment. Do you remember Misha?
Yes,
Yeah.
yes.
So she took one of my courses.
Okay.
And it was like, I mean, it was just like this weird twist of irony, and what a wonderful lady she was.
Yeah, Misha was one of his main physios.
Yeah. Mm-hmm.
Yeah.
I love that lady.
So that's how I was introduced, and then so happened Pavel was in LA. I met Pavel, and that's how we started to connect with one another. Pavel is so gracious. After that class, he told me, "Come to Prague."
Yeah.
And so I went to Prague for 2 weeks to hang out with him and learn from him, seeing patients. It was not a course. It was just observation. And then I spent a lot of time with Marcella and Shaka. So those two physios were assigned to me and got me exposed to the world of, at that time it was not called DNS, but the world of Pavel.
Yeah, Pavel's brain. Yeah, beautiful. Well, it looks like we just broke for the next one.
All right.
So, Claire, thank you for sitting down with us, number one. Thank you for your influence. This won't be the last time we sit down with Clare Frank, I guarantee you. And so we appreciate everything you've done for us, and thank you for being here this weekend.
If people want to get a hold of you?
Oh, then just check me out at movementlinks.com or clarefrank.com.
Got it.
Perfect.
Beautiful. Awesome. Thank you so much,
guys.
Claire. Appreciate it. Yeah,
Thank
appreciate
you.
it.
Yeah.
Great job, Claire.
I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.